everybody. I'm Michael Munson with Forge. I am technically Forge's executive director. Forge is, for folks that don't know, a trans anti-violence organization that's national in scope. We predominantly provide training and technical assistance to victim service providers and other allied professionals, as well as do some direct services with the trans community, mostly around trauma and victimization. We've been around for 28 years, so we are older than many of you who might be here are. And we're glad to been able to be around for so long and continue to do the work that we do. I just wanted to take a moment to acknowledge the land that we are all sitting on. I know that we are in different places around the country. I know that in Milwaukee, Wisconsin here, I am sitting on the land of the Potawatomi, and I am grateful to be on this land and knowing that it is not ours that we initially founded. So if folks could just take a moment and recognize the land that you're on, however you choose to recognize and honor that. Thank you. For visual accessibility, I am a white appearing person who's kind of round, has glasses, graying, brownish hair and beard, with a black shirt, black background, and a little teeny bit of a white t-shirt that looks like I'm a priest, but I'm not. So that's just for a little bit of visual access. We are really excited about tonight's topic to talk about abortion, reproductive rights, trans health, and a whole bunch of other things that will be a surprise to me a little bit and a surprise to all of us, but it's going to all focus in that general topic. Forge has been connected with Jay and Afton for probably 10 years, something like that. And they have just an incredible amount of knowledge and experience and all the really good, wonderful things. So I'm going to let both of you introduce yourselves and take us away, and we'll have some time near the end for questions, and people can put questions in the chat as we move along. So thank you very much for being here, and welcome, Jay and Afton.
Yeah, thank you so much, Michael. Yeah, it's a honored to be here. Like Michael mentioned, Afton and I have been connected with Forge's work for a long time, and actually did like a little mini photo shoot a long time ago at the Philly Trans Health Conference. So yeah, it's great to be in community with folks doing the work. My name is Jay. I use they, them pronouns. I have a background in social work. Currently do trans health at a local clinic that also provides abortion care and reproductive care. I have a background in providing LGBTQ affirming healthcare services, HIV testing, all kinds of stuff, harm reduction, immigrant justice work, worked with survivors for a really long time in West Virginia. So all of the things that we're talking about tonight are really at the intersections of what I'm most passionate about.
Hi, everybody. My name's Afton. I use they or he pronouns, and I am also very grateful to be here tonight and have loved all the work that I've done over the years with Forge and Michael, and have seen myself transition through my social work and nursing career, all culminating to these different events through Forge. It's been lovely to kind of see that process. My background, I'm currently a nurse practitioner. I also have a background in social work, and as an RN, I've overseen 2 trans health programs in Virginia, and do a lot of training and facilitation and teaching to healthcare and mental health providers regarding LGBTQ health. I also am an abortion provider and have been around sexual health and reproductive health for many years, and all of my different kind of credentials and licenses. So love talking about this topic, an unfortunate series of events that's led us to talk about this topic tonight, but hopefully we can all be in community together and learn from each other and find ways to find a way to work together to help expand access and provide space for those that are struggling right now. So I'm going to go ahead and get our presentation up. I do want to apologize. We've had some last minute shifts of where I'm presenting from. So if you hear dogs in the background, I do apologize.
All right. So like Michael said, we have a lot of different things that we hope to present to you today. We want to talk a little bit about the history of these two things in our country here. And we also want to talk about the implications of what we're currently seeing and some current political climate framework, as well as the implications that it's having on trans folks accessing care. But we wanted to first start with more of this framework for folks to understand when we talk about abortion and trans healthcare. We really want folks to understand that these two kinds of healthcare are being put under attack by the same forces. And really, when we say that, what we mean is that abortion and trans healthcare are provided at the intersection of some very shared oppression, mostly misogyny, gender-based discrimination, and violence. Although I think if we had time to explore all of these different things, we could probably name a lot of other things that they share at the intersections. However, what we know when we see legislation wise and what we see that's happening across the country right now, when you really sort of dig at it to its core, you can break it down into these three things. And really over the last 50 years, we saw the conservative right in the United States creating a playbook of anti-abortion legislation, which you can follow, and that what this framework has done now, unfortunately, is that it's being used, the same playbook is being used to restrict access to trans healthcare. And it is absolutely our responsibility as folks that are fighting for reproductive justice to also fight for trans liberation and to collaborate in our organizing strategies because both of these things are defending, as we know it, life-saving care. We know that abortion is life-saving care, and we know that trans health care is life-saving care. And so that we know that we must come together to fight for these things and to also expand access for individuals. And also we feel like it's our responsibility to kind of understand and enter this moment with a historical understanding of some of the things that have happened in this country, particularly around abortion and also trans healthcare. And that all of these attacks politicize our bodily autonomy and access to essential life-saving healthcare. When it comes down to it, you know, sometimes I only get like a blip when I'm talking to like the press or something. And so what I often like to leave people is that trans healthcare and abortion care at the pit and root of it is about attacking our right and our bodily autonomy and our autonomy over our bodies. Afton and I had the pleasure of speaking at a few rallies in Virginia before we knew the Dobbs decision was going to happen. So we just wanted to share two very short clips if we could.
Reproductive justice demands that trans people have access to health care. It demands that this fight uses inclusive language. Trans rights are reproductive rights.
Everyone, and I mean everyone of every gender and every body, deserves bodily autonomy and self-determination over themselves.
When we were asked to talk at these presentations, we originally were asked to share our abortion stories as trans and non-binary folks, but also we wanted to make sure that people knew that trans and non-binary people get abortions. So to be careful and inclusive of language when we talk about who gets an abortion, but we also wanted to share with folks that at the same time that abortion is being attacked in our country, we also have trans folks that are being attacked using the very same attack. So we wanted to, just like our presentation talks about, we wanted to bring a solidarity to the crowd to realize that all of us, when we come together, can fight this together, and we're more powerful in numbers. So we wanted to make sure that all of those things were brought up. So we'll include that so you guys can watch it later.
And so, as Jay had said, part of what we wanted to do tonight in a very brief way, due to the time that we have together, is to make sure that we have an overall understanding of the history of these two topics, to help kind of further solidify those intersections that we are seeing play out more than ever, I think, and more people are paying attention to. So very quickly, in a very short brief history of abortion access. Obviously, this topic could be books upon books. So a quick synopsis is that, as we, I think, all know and believe, that abortion has been around as long as there has been birth and as long as there's been human races and society. Unfortunately, it is a common misconception that the Christian and Catholic churches have always stood in moral opposition to abortion. So a lot of our understanding of abortion access and laws, particularly in our country, are more rooted in more recent history, and it hasn't always been that way, and that's important to keep in mind. According to the Guttmacher Institute, in-clinic abortion was made illegal under most circumstances in most states beginning in the mid-1800s. This happened to coincide with the change in the Catholic Church that we saw during that time period. Also important to note that we also saw a lot of laws restricting abortion access come out also with the adoption of the American Medical Association. And a lot of that also had to do with the distinction that physicians, predominantly male physicians, were trying to make between them as doctors versus other health practitioners, for example, midwives and nurse practitioners who were predominantly women at the time. So some of it also didn't have as much to do with abortion specifically, as much to try to draw further distinctions and hierarchy amongst healthcare providers. And then in the 1960s, the women's liberation movement began mobilizing around abortion rights. And then in response, what we saw was a backlash in individual states, then began reforming some of those anti-abortion laws, thankfully resulting in 17 states permitting abortion in some circumstances prior to Roe v. Wade, which Roe v. Wade is also what's brought us here today. And unfortunately, the fallout that's happened in the Dobbs decision. What we know is that anti-abortion extremism, ushering in the anti-abortion domestic terrorism, which marred the movement for much of the 80s and 90s, which has lasting fascist reverberations. So really, when we think of the context of abortion access in our country in the last 30 years, and some of those more extremist movements, the attacks on clinics and providers, those are much more in recent history, and there's a long-standing history prior to the 1800s where how we performed and provided access to abortions, both on a community level and from a healthcare provider, definitely looked a lot different, and access wasn't always as restrictive as we historically have always believed it to be. And similarly, we wanted to make sure that we all had a shared understanding of a brief history of trans healthcare, specifically referring to the westernized approach of this care, and particularly in our country. So what we know is that gender diversity and the affinity of gender identities has also existed since humans were born. So just like abortions, people have always been gender expansive and diverse and found ways to find affirmation and euphoria in those bodies of existence. The recorded history of gender affirming care doesn't necessarily begin with Dr. Magnus Hirschfeld from Germany, but he is a prominent signpost. So often when people think of where did this medicine and this practice of medicine begin, it's also often cited going back to Dr. Hirschfeld in Germany before the 1940s. Dr. Hirschfeld founded the Institute for the Science of Sexuality in Berlin, and that studied queerness and trans identity in a radically positive way, especially for the time period. And much of what we still practice and follow in the ways we shift care really begins with some of those ideas and concepts. It began to be open in 1919. It was unapologetically pro-queer and pro-trans. It offered education, conducted research, provided medical services to the large community, and it also housed many prominent leftist and well-known trans individuals of the time. Unfortunately, much of that work that was done and accomplished, we have lost because in 1933, a Nazi student organization looted the Institute and burned all the books and research it contained. And many cite in terms of where we've come with this care that we lost a lot, and a lot of time was lost and progress was lost, and we didn't really see the same focus on research and education and services really shift again for another couple of decades. So when we think about care in the United States, the first formal protocols for gender-affirming hormone therapy were published in 1979 by the Harry Benjamin International Gender Dysphoria Association. That is what we now know as WPATH, or the World Professional Association for Transgender Health. So those of us who've been practicing for a long time remember this being called the Harry Benjamin Standards of Care when it comes to providing hormone therapy. So Dr. Benjamin was a German-American endocrinologist. Early in his career, he studied sexology with Dr. Hirschfeld in Germany. And then upon moving to the United States, Benjamin ended up in a radical sex-positive circles for that era and time period with Margaret Sanger, who many know as the founder of Planned Parenthood, and Dr. Alfred Kinsey, who many also, I believe, are familiar with in terms of his, at the time, progressive views when it came to sexology. And obviously, there's been a lot of progress since then when it comes to a lot of those ideas and concepts. Hormone provision in gender-affirming medicine definitely was occurring well before 1979, and also probably predated the Hirschfeld Institute in Germany. But WPATH standards of care were the first published professional guidelines for healthcare providers. So it really was the first time that providers had something that they could refer to as like a standard of care or evidence-guided, evidence-based practice that was more universally accessible and adoptable instead of individuals, practicing based on their own learned experiences. Early westernized approaches to treatment that continue to cause concern were modeled after the concepts of what we know has been historically documented as a true transsexual. And I highlight this because it's important to understand that even now, this has become a barrier and still is a barrier, but for many, even though this care was accessible, it really was not accessible to many because you had to follow kind of preconceptions of heterosexuality and a binary gender model in order to access care. So often you were not able to access hormone care or surgeries or other affirming medical care if you did not identify and your goal is not to become somebody who is heterosexual or straight of the gender that you were identifying and transitioning and seeking care for. And you had to fit very strict requirements in your providers or these guidelines views of what it meant to be a man or a woman. So it really wasn't accessible to everybody. And unfortunately, we still see some of that play out when we're talking tonight about autonomy and reproductive justice. I think it's important to also highlight, especially when we're looking at the intersections of abortion and trans care, how reproductive autonomy and sterilization have been concepts and concerns that have had profound impact on this community. So as I think many of us know, when somebody is intersex, that does not mean necessarily that they are trans, and those are two distinct identities and concepts, but we know that there's a lot of overlap in that some people who are intersex are also trans. And there's been a long history of genital normalizing surgeries and other really horrific practices that have been done to the intersex community that have really removed their sense of autonomy and informed consent. And that is something that I think we also see happening when it comes to access to care for queer and trans bodies too. We know that many legal document change requirements, so things like your gender marker on a birth certificate or other steps you may need to have your documentation accurately reflect who you are, requires surgical interventions, and some of these surgical interventions that are required in certain states or countries do lead to permanent sterilization. So in order to be seen and have your documentation accurately reflect your gender, you have to be forced to make that decision of going through surgeries that do impact your fertility in a profound and more permanent way. Hormone therapy also has an impact on fertility and reproductive health, and for many historically and many still, it is not often discussed when people are beginning treatment, or maybe a side note that is mentioned on like a document or consent form somebody is signing. So often having conversations tied to sexual health and pleasure and fertility and reproductive health are not always happening when it comes to accessing hormone care. And that of course would also extend to things like access to contraception and abortion care as well when needed. We also know that there has been and continues to be a lack of inclusive providers and organizations for individuals who are seeking care related to reproductive and sexual health who identify as queer and trans.
So when we were thinking about doing this presentation, we not only wanted to talk specifically about a little bit later in the presentation, we'll talk about some things that are happening currently and how what we've been talking about is showing up. But we would be it would be a huge mistake not to mention that at the root of what we're talking about is colonialism and gender-based violence, because what we know that both with gender and also with the way that people took care of each other, a lot of these things were impacted by colonialism. And you know, when we talk about the diverse range of gender and sexual identities, we know that these were embraced by Indigenous people, and that and still are embraced. However, when European Christian views became the more prevalent, dominant parts of the community, what we know is that these transphobic and homophobic perspectives were popularized, and that I thought it was ironic that you know, that we were doing this presentation a day after Indigenous Peoples Day, which, formally here was recognized as Christopher Columbus Day, because what we know is that many people's ways of being, as far as their sexual identity and their ways of gender, that were destroyed or attempted to be destroyed or changed, or were forced to, have their hair cut, or and forced to go to boarding schools and all kinds of things, ripping people's identities away when Western colonialism, basically started. So we wanted to really express that we know that a lot of gender-based violence that people experience, whether that's violence against people's trans and non-binary identities, or violence against people that are seeking abortions, or violence as intimate partner violence or other state sanctioned violence, really is rooted in colonialism and the history that we know it to be. This could be another presentation that we could spend hours about, but I think it's particularly important to mention it, because if we look at if we look at it from a framework of this, we can look at it as a way to fight as well together, because these institutions of colonization really rely on strategies of oppression that people have used throughout our country: access to resources, political power, and when we much like I was saying at the beginning, when we look at these things as two fights that are interconnected and for liberation for everyone, we are a lot more successful in those kinds of ways. So that's like obviously history, overarching history, but what we wanted to talk about a little more closer is just some things that we're currently seeing that are mimicking a lot of each other. So the shared basis of gender oppression, like we said at the beginning, are but also the shared attacks of strategies for abortion bans and trans healthcare bans. Texas is a prime example. So a lot of people may have heard that when the governor of Texas ordered an executive order on trans youth to essentially turn people in for trying to provide trans health care or support their or parents supporting their trans kids or loved ones, to turn this into a case of quote unquote child abuse, so that it almost became, from what he considered, a reportable offense of child abuse. And we're seeing this same sort of thing that has happened for abortion care as well, is turn your neighbors in, rat out, tell on a provider that's providing abortion care, tell on this person that's going to seek abortion, or look on their internet searches and stuff like that. It's the same sort of mirroring that we're seeing that's occurring, unfortunately, for both of these communities. This number, it may even be not quite accurate right now. It could be a lot higher. But I pulled out this report from the ACLU that said currently In 2022, over 300 anti-trans and anti-LGBTQ bills have proposed in state legislators. 20 new anti-trans bills have become law over the past 3 years. Like I said, that number is probably a little bit off. And in the same period of time, 541 restrictions aimed at pushing abortion out of reach have been proposed. 38 have become law when this report was studied. So you can see how similar they are, and how many, unfortunately, how high the numbers are for these folks. And I think it's also important to note that, unfortunately, what we're seeing right now happen to trans folks across the country, and particularly trans youth that are trying to seek care, and the providers that are doing it. If you have been involved in the abortion movement, or if you've worked in clinics and things like that, like Afton and I have, or if you've had the privilege to work with people that have been providing abortion care since like the 80s, which Afton and I have. We haven't, but we're not that old. We've worked with providers that have been providing that care for that long. A lot of the conversations that I'm having with folks is that they're seeing a lot of these same things, and these websites, and most recently, folks may have seen the anti-trans map that people were passing around, that thankfully Google took down. But it was a map that was listing where trans people could get care, and actually a person made this map for trans folks to access this care. And then unfortunately, anti-trans folks got a hold of it and then used it as a tool to show people around the country where these things existed. And the same sort of language that was used on that website mirrored a lot of the same sort of wanted posters and bounty hunting kind of things that was used in the 80s when we were talking about that extremism that was really happening, when there were like really scary things happening. We're kind of seeing the same of people using those tactics. And yeah, now protesting centers that provide gender affirming care, utilizing authorities, filing reports of harm, abuse. So you can see where these solidarities, like we talk about, are hand in hand of people on the anti side, and how we on not the anti side can try to protect and hopefully stand up for each other and try to take care of one another.
The one thing I want to add on the slide to you is that unfortunately this is what we're facing, but also because healthcare workers who have been a part of abortion care in our country over the last decades, unfortunately, have had to face these tactics for years now. We fortunately do have a lot of tactics of our own and are utilizing those as well to help make sure that both the people providing care and people who are accessing care, we can share those strategies to help make sure that everybody can be safe, and that we can help ensure access as much as we can. So I just want to highlight that those shared strategies that have existed play well into the same things now that we're seeing faced by providers who are providing care to youth, and then also those youth and parents and loved ones and guardians who are trying to support their youth too.
Yeah, thank you so much for that. I was going to bring that up if we didn't talk about that often, but that is such a when I say we take care of each other, I absolutely mean that, because a lot of people are like, how do I get involved? I'm not someone that shows up and protests and screams about my abortion like you. And I'm like, yeah, I totally get that. But what we can do is take care of each other and share these tactics. And because we have learned so much from people that come before us through all of this, there are just such incredible solidarity of folks that are sharing all these resources. And if there's anyone on this call tonight that wants to see that a little bit more, I'm actually compiling a lot of resources currently for my clinic. So if anyone wants to do some resource sharing, I would be more than happy to make sure that I get that to Michael to like go out to folks, or Michael can share my email and stuff like that. But we just wanted to give you a quick graphic. Sometimes people are visual people. I love visuals. So this is a little map of where anti-trans bills have been passed in the states. You can see where some states are, thank you, Michael. Some states are more like pinkish than others. And if we slip to the next slide, you will see the anti-abortion map, which is, this is the most current one as of recently of our political landscape that we're seeing. I am going to note that this literally changes. Afton knows this. If you work in the field like we do, this map can change day to day based on different states have different lawsuits going on right now. So what we see here doesn't necessarily mean that's going to be like it forever. But you will notice some similarities between the two of where some states are most restrictive versus what are not. Particularly what stands out to me is when I look at it right away, Texas sticks out to me, especially when we think about how, Governor Abbott tried to talk about how providing trans health care is child abuse. So, yeah.
Then I will definitely echo the active changes. I can speak as working with individuals over the last 7 days that this map has shifted when trying to help individuals. So definitely for those who are engaged in helping people access both, whether it be care related to being trans or non-binary or abortion access, to utilize these maps, because people are working very hard to keep them updated to be sure that we're providing the most up-to-date knowledge to those in our community.
And I will say that, as of a lot of people have a lot of questions about, about trans healthcare being, like a similar decision coming down as and the Dobbs case. And that's a real reality, because like Afton and I, when we talk to our young people that are wanting to start hormones or talking to families, that really is something that a lot of people are concerned about. But what we know is that that's not currently, there are no situations like that happening, but there are states that are starting to come up with different things. So it is really good to kind of know the landscape of where you're working or around of where you're working. So implications of criminalization. What we know is that when we try to criminalize or make it illegal to seek care, or these also I think might have been out of order. Are they often?
You're good. Sorry.
Okay. I just wanted to make sure. What we know is that when we try to make things criminal, what we know is that it's impacting the people that are receiving the care, but we also know that it's also discouraging new providers and students and things like that from wanting to seek this care, especially when you're seeing all of this kinds of like we just like in the map that you saw, that when there's all these like things that are being thrown at us, there's a reluctance to want to, sometimes, not always, but there's a reluctance to want to do this kinds of thing because of the fear that it creates in the state, in the community, which then, makes us experience shortages of care providers for both types of care, and fewer providers learning to do it. It also makes folks feel overwhelmed, and providers feel targeted, feel unsafe, as well as patients. And if this country continues to criminalize gender-affirming hormone therapy and care, the impact of trans care providers will be profound. Essentially, if trans care continues to follow the political trajectory of abortion, we're going to see higher risks of types of harassment, discrimination, and violence.
And so when we look at the Dobbs decision specifically and how this has implications for trans healthcare, just very quickly, for folks who may not know what the Dobbs decision is by name, that's referencing what occurred on June 24th of this year when the United States Supreme Court released its decision in Dobbs versus Jackson's Women's Health Organization, and that was what overturned the constitutional right to abortion, or as many people I think refer to this as when Roe v. Wade was overturned, I think is how a lot of individuals may know it by, as opposed to the Dobbs decision. So what we know is that when we see these restrictions and different practices changing and evolving in fear of further restrictions or legislation, that individuals have to travel further for care for both abortions and trans care. We know that the barriers that trans folks experienced prior are only being exacerbated. We already know that there was a shortage of access to this care and to providers performing this care, similar to abortion care. And this is only exacerbating the gap that we know existed already for this community, and that is especially true for BIPOC folks. We know that we have seen clinics closing related to abortion care and no longer being able to provide care, and unfortunately, if we see similar legislation and restriction when it comes to trans care, we also might see similar practices. It's important to note that we know collectively that many trans individuals do have experienced trauma, and this trauma can further that reluctance to seek care. For many of us who have been involved in providing care for this community, we know many of the studies that have unfortunately shown and worked with individuals or in communities to see the unfortunate trauma both that has existed when accessing and trying to engage in the medical care, and also just the trauma that can be inflicted in living your authentic self and being trans in our society. And things like this can really confound that trauma. So as Jay had referenced, working with individuals, and I myself have too, where seeing this decision automatically, sparked fear and concerns and anxiety, and meaning, would they be able to continue to access hormone care? Do they need to stockpile medications? What does this mean for somebody who is just getting ready to turn the age that would be appropriate to access hormone care, and now it's being restricted? So unfortunately, we see that trauma continuing to exponentially expand. Individuals may be scared to seek care, especially facing protesters at clinics that provide abortion abortion and trans care, and we know that there are a good number of clinics that provide both of those services. Providers who are in clinics or in clinics who are in states where abortion is still legal are now being overwhelmed with a surplus in demand of people accessing that care. And so we see that turn into longer wait times, people having to wait longer to be seen for a visit, and exhaustion from staff. Individuals may be afraid that their care or hormones will be taken away from them at any time, as I had mentioned. And politicians, as we know and have seen more and more recently, using that same language that we see when it comes to talking about abortion access to target trans youth. So what we can look at when we're looking at how the landscape of the care that providers and communities and clinics are providing and how this can evolve. We know that some organizations that can no longer do abortions, so it has been restricted in their state, they now have more capacity to provide other services, and we've seen a large number of them make a shift to increasing their capacity for gender-affirming trans healthcare. I myself have participated in training several providers and a few clinics in other states to help increase this access, as they now have staff who were already ready and excited about providing this care, and now they have the time and devotion to be able to spend to really learning this care well. So we see providers and clinicians wanting to get trained, reaching out, seeing people calling saying, how can I volunteer? How can, are you hiring? How can I help you? How can I help your staff get trained to provide this care? We historically have utilized networks both virtually and in person and prior to the advent of technology, but now are able to use technology in a growing way with the serves to increase access and mobilize advocacy. So when these tactics or legislation or bills are coming forward, really drawing on those connections and networks to rally, to call our politicians, to show up, to show how important and life-saving this care is, and to help network when we can no longer provide care and where people can go for care. And also, just as if not more important, community solidarity. So also seeing not just those kind of organizational, systemic spaces of healthcare institutions, but also seeing mutual aid and communities coming together, both along with providers and individually within their own communities, to work together to both to advocate for effective policies and change, but also to help individuals on a needed base and help them get access to the care that they need.
Yeah, and one example that's not on here, but I wanted to, well, two examples that I wanted to share real quick. One of them was recently, you know, in the trans health program that I help coordinate and stuff like that. We had an organization that had reached out, you know, that knew me from just doing trans stuff, and that they're a LGBTQ focused organization, sort of like a recreational type organization in our city. But when the Dobbs decision, or when Roe fell, they were just like, we don't know what to do, but we want to do something, but we want to make sure that it makes an impact on, you know, you all that are doing abortion care, but we also want to make sure that it is like rooted in our values also as, you know, people that stand up for LGBTQ folks, particularly, you know, their trans members that were feeling like isolated. So they reached out, and we they actually they have a lot of money, so they wanted to donate, and they were like, you know, we want to make sure that this goes to you know, people that are accessing reproductive care, but mostly like our communities. And so I was like, oh, that is so wonderful, because you know, in my particular program, we have a fund specifically for trans and non-binary people that are experiencing financial difficulties, much because of all the intersections that we briefly talked about earlier. So, you know, this was a great community solidarity in that they were able to give money to ensure that, you know, trans and non-binary folks can get access to hormones and have abortions and all kinds of things. And we're continuing to build that relationship to where they want to keep funding all next year for us. And then the other one I wanted to mention is more on a state level policy. So in Virginia currently, we've made national news about this. Our governor flipped some policies for trans students with the Virginia Board of Education. We had some really solid framework to protect students that he has reversed with the Department of Education. And a lot of folks that are working on that, you know, us in the reproductive world and them in the trans liberation or trans rights world have helped each other out in when we have rallies, they show up there and they speak. And then when they have rallies, we show up there, you know, and vice versa. And also pushing each other's tools and all kinds of stuff about how to reach out through each other's like networks and stuff like that. So we're really mobilizing these efforts together, much like we talked about at the beginning. We're seeing it as you know, shared solidarities. We're seeing it as that we have to show up for one another because these things are so connected, and none of us are free unless all of us are free. So we wanted to give you sort of like what's next, just some real quick things, because I think that we could talk about this forever. And there are probably some really powerful people in the room that have beautiful ideas of what could be next as well. But what we really wanted to do was make sure that that we talk about this through a lens of reproductive justice, because our next phase of movement, in my honest opinion, and I think Afton's honest opinion, is that we have to evolve rapidly in order to win. I do believe that we will win. You know, I always reflect on myself whether I will see it in my lifetime. I'm not sure, but I know that I live personally to affect change and make it so that folks that will be in this world after me will be able to authentically live themselves. So like that is what I hold on to when I fight every single day for folks. And in order to do this, we have to, absolutely have to embrace intersectional, trans inclusive feminism as the way forward. We have to build solidarity amongst each other, and not only build solidarity with the reproductive justice movement and the trans movement, but we have to also build solidarity with for Black lives, for the labor movement, for the anti-war movement, immigrant rights movement, climate justice movement, disability justice movement, indigenous liberation movement, because all of these things are intersected in one another, and that when we fight forward using these lenses, and we think about it in diverse tactics with all sorts of people involved, we are extremely powerful in that way. One of the things that I screamed at that rally was that there are a whole lot more than us, and I really sincerely mean that when I say that, is that I don't think people realize how truly powerful we are when we fight together and when we live authentically as ourselves, and that we, in my opinion, we have to dream of a world that offers us more protection than Roe versus Wade had. We have to fight for true reproductive justice. It is good that we had Roe versus Wade to protect abortion rights, but we have to dream of a world that goes even beyond protections just in the court. Because, you know, there's a lot of way people can look at it is that if we have legislation like that, but just because we had Roe versus Wade doesn't always mean that everyone had access to have an abortion. Someone said it earlier in the chat, you know, people of color didn't always have and still don't have access to those things that we were talking about with Harry Benjamin. And so in order for folks to truly live into their bodily autonomy and live authentically with whatever that means for them, we have to go beyond, you know, what someone decides for us at the court level. And reproductive justice, for those that don't know, was coined by Black women from an organization called Sister Song. If you all haven't heard of them, I highly suggest you look them up. But in very short terms, reproductive justice means the right to control our sexuality, our gender, our work, and our reproduction. And on the next slide, I borrowed this directly from their site. You just click forward.
Yep. And before we move forward, I just also, just because we're trying to hit on the topics every time we're talking. So similar to, you know, Roe versus Wade, while it did provide access and protection to some, it also, of course, left many gaps when we think of folks based on like economic status, Black and Indigenous folks, many folks just living in rural spaces. And we've seen that same issue when it comes to policies and court decisions and law play into trans healthcare too. The Harry Benjamin standards of care were already referenced, and another one that I also like to highlight that was a policy was when we looked at the Affordable Care Act and protections that were written in policy to protect people based on their gender identity and sexual orientation. And what we know is that while that policy was on paper and in writing and was passed as legislation, that we didn't see that mean that people weren't still being discriminated against when it came to trying to access care, utilizing insurance and health coverage. And we still saw and still see now profound gaps when it comes to people being able to access this care versus having insurances that are, you know, like Medicaid versus commercial insurance, and still seeing those same disparities and gaps when we think of Black and Brown trans folks living in poverty, and people living in different states having different access and rules based on how those companies and healthcare institutions have interpreted those policies.
Yeah, and all of that is reproductive justice. One of the things that you know, one of the reasons why we wanted to show the clip of Afton on the stage was that you know, they said trans, you know, rights and trans healthcare is reproductive justice, because all those things that Afton just mentioned, like they are all reproductive justice for trans folks, and sometimes not always, like when we talk about like reproductive healthcare and reproductive stuff, trans people often get left out of that conversation. But when we look at it from the framework of which we started this presentation about it being bodily autonomy, and about how we get to make the decisions for our bodies, all of those things are so related to one another. And so Sister Song says in order to achieve reproductive justice, we must do the following things. And that's what I wanted to leave with you today, because I really think that what Sister Song has to share really is at the framework of all of these things, and how if we think about the work that we're doing with trans folks, and also you know, well, not just trans folks, like anyone in general, honestly, but particularly trans folks and abortion care, these sort of tactics and things like that uh, are helpful to keep in mind, or maybe just like think about a little bit, because I know when I was first introduced to the term reproductive justice, I didn't know a lot about it. So I spent a lot of time just like reading, what these folks had to share about how to approach about this work. So I highly encourage folks to just maybe like sit with some, like get on Sister Song's website, listen to some webinars, sign up for those, to just kind of soak it all in. So basically analyzing power systems like we talked about, addressing those intersection oppressions. Audre Lorde said there is no such thing as single issue struggles because we do not live single issue lives. Sister Song says marginalized women face multiple oppressions, and we can only win freedom by addressing how they impact one another. Center the most marginalized. Everyone should be able to access resources and full human rights to live self-determined lives without fear, discrimination, and retaliation. And join together across issues and identities. All oppressions impact our reproductive lives. RJ is simply human rights seen through the lens of nuanced ways oppression impacts self-determined family creation. The intersectionality of RJ is both an opportunity and a call to come together as one movement with the power to win freedom for all oppressed people. And so I thought that was really beautiful RJ is reproductive justice. I apologize. I thought that was really beautiful when I revisited their values and what they said to achieve reproductive justice, because I think it kind of sums up a little bit of what we've been able to share tonight about the solidarities of trans people and abortion care, and that, times are scary, y'all. Some days are better than all others for me. Some days I feel very overwhelmed and scared, like a lot of patients that I'm talking to. And I sometimes am like, is it ever going to get better? Is it going to keep looking this way? And sometimes I feel really powerful when I'm in community and see how incredible people are taking care of one another. So it fluctuates between feeling disheartened and feeling empowered. But I really, really strongly believe in my heart that if we do fight in this way, that we do have the power to win. And I do think that we will win if we come together like this. Yeah, Afton, I don't know if there's anything that is all we had as far as like our slides. We wanted to make sure that we left time for questions, but I want to make sure there wasn't anything I was forgetting to, Afton.
No, I think we were really intentional, knowing that, as we said, this topic obviously could be an ongoing series, and would love to also hear from others, because we also respect that we are obviously not the only folks doing this work with expertise in the room or in the movement. So we wanted to make sure to save space for folks that either wanted to raise any questions for us or for just all of us to discuss, or if people have anything they want to lift up or anything that they would like to contribute to this conversation. So I'm going to mute myself now so that we can see if anybody wants to add to this dialogue.
And I pop back on. Oh, Afton, good. You have,
Your face
have
is
a
back.
face in the video. Yay.
Sorry, for context, the reason why I didn't have my face up is I live out in the country and my internet is not great. And when I have different videos and screens happening at the same time, it does not like that. So I now can show my video.
Really cool. And I think this is one of those great things of having both of you here, because like you are in rural communities versus like some of us who are in bigger cities who don't always have good internet either. But it reminds us all of like, you know, it's not always accessible to go fast and share screens. So I really appreciate that awareness. We did have a couple of comments, and I also am aware that we've got some providers here who are also in the loop of things, which is really great. So the one question in the open chat, if I can just read it out for everybody, is Joanna says, one of the things that I struggle with is that many feminists support the right to abortion, but not the right to transition-related care. I'd love to hear the panelists' thoughts on this and how we might move these two issues together across that demographic.
Yep.
Great question.
You wanna? This is where like who
Flip a coin
answers
for
it?
both of you.
After, do you want to start? Or I've been talking a lot. I have some thoughts, but I know you do too.
First, I'm going to focus on it from like those of us who are in healthcare and this feminist movement together, because this is often also a shared issue that comes up when we're working together with gynecologists or women's health nurse practitioners. And what's been very pivotal and helpful that I found to have those conversations. One is looking towards those establishments who have created statements, really demonstrating how we can see like reproductive care and quote unquote women's health as also inclusive to trans bodies. And it is similar to this tie of this bodily autonomy conversation that we're having, and that in order for any of us to have access, freedom, and rights. That means everybody. And I think one thing that can unfortunately be a struggle in this conversation, which I'm sure you're not immune to, the person who raised it, is when it comes to seeing trans women as women. And I know that that is been a struggle that I've had in working specifically with healthcare advocacy and rights, and really having open conversation with those individuals and talking about gender and talking about what it means to be a woman, what it means to be a man, what it means to be neither man or woman, and pulling together those shared similarities, which both could be shared forms of oppression, but also shared forms of great things too. And I find that when we can put more diverse people in the room together to share these conversations, we start learning that we have much more in common. And unfortunately, when we separate ourselves and we don't interact with others outside of our own community, it further creates that divide, because for a lot of people that I've worked with over the years, when it comes to thinking about trans and queer bodies, they don't have those connections in their personal lives, and they only have what they reference in media. And unfortunately, media, as we all know, can sometimes reinforce some of those stereotypes and divides. And so what I've found to be very helpful is we've done a lot of like shared kind of like dinner time conversations, like sharing meals, and opening up dialogue, bringing in, you know, for example, we did a really great conversation that involved some elders of the Black community that were advocates for like abortion care and women's rights in the community, and folks that were also trans women of color, and brought them all in the room together to talk about how we could like do this movement together. And I think that really getting to know people on an individual level, to me, has been the one thing that has really helped kind of bridge that divide, because unfortunately, I think until we can hear and live and learn people as humans and not just these short kind of narratives, I think that it is hard to sometimes fight that resistance.
Jay, do you want to add anything to that?
No, I mean, that's exactly what I was thinking, is that I think it just takes real, I think, time and conversations, just like Afton was sharing. It's not just like a PowerPoint or something that you can throw up there. But I think it's really like intentional work, and it's something that we've both had like the gift of being in rooms with people and seeing it happen. So I think it just takes a lot of intentionality and more about like, yeah, what do folks have in common, and particularly like if we look at it from people that are trying to strip away all of this, like how it impacts everyone, not just a certain population. So yeah.
And I don't want to take over anything, but I do want to add
No,
just a
please,
little tiny
Michael.
piece, just
Yeah,
a little
yeah.
tiny piece,
Yes,
which
please.
is, I mean, after you mentioned like bringing people together for food, and it's like, I think a lot of times we think about, well, how do we do organizing together? How do we do these official things together? And sometimes we need to like take 5 steps back and say,
Yes.
let's have a meal together. Let's sit in a park together with our masks on or whatever feels comfortable to us. And let's get to know each other. Hi, how are you? What's your favorite color? And I'm not being glib about that, but like when we know and can get to know people, it really makes a difference. So I'm glad that you brought up the food piece, because I think that's sometimes where we need to start.
Yeah, and I think, a lot of it's, similar tactics I think we use when it comes to like our work environments too. If we don't know the people that we're interacting with on a more personal and human level, if we can't get down to those core pieces, even if we don't have a lot in common, it's really easy to villainize the other, because you can start disconnecting that shared human aspect of ourselves. And we know, especially I'm sure many people in this virtual room, can think about the history of trans bodies in our country and others, and how a lot of the violence and oppression that we see is because it was so easy to other our community. And the more representation and the more we're able to come together and have these conversations, and those conversations we know just in our personal lives, we tend to listen to folks that we do have that kind of trust and solidarity in, which we develop through forming more personal, conversations and relationships.
Yeah, absolutely.
That's beautiful. So there's a question that's in the Q&A, and let me just read it off for folks that may not be able to see the screen. Question says, in the meantime, while these fights are being waged, based on the current climate, do you think that someone with a trans small child should expect to have to move to get gender-affirming care for their child if they live in places like Wisconsin or Texas? Really good question. And as people are, as Jay and Afton are answering, if folks want to add more questions, please feel free to do so in the chat or the Q&A.
I'm so glad you asked this participant, because I wish I knew your name, but I get this question, actually. I've gotten this question a lot when I've talked to folks, particularly like parents that are concerned, because right now, like I mentioned, in Virginia, where we currently reside, because of the stuff that's happening with the governor and the school, a lot of parents and loved ones fear that the next step is for him to say something about their care. And so this conversation is unfortunately something that a lot of parents are worried about. And I honestly, like, I don't feel like I have the right answer for them at this moment, because there are so many things to hold at once right now. So I don't feel like I have the right answer to say, like, absolutely you should move or you should do XYZ. What I usually can tell them is that there are a lot of people that you know, see them and see what is happening, and are just as worried for their kiddos, or their, you know, their young adults, as they are, and that we you know, are in solidarity with them, and that you know, we are going to do as much as we can to fight this resistance, and make sure that we are. But we and you can also get involved with other organizations that are doing this, not just us, but so many organizations. But I feel like I don't have a particular answer. I do know that that answer would also come with a lot of, like, do you have the access to get up and move? Because do you have money? Do you not? You know, like, people are rooted in their family and their community, so that's a really hard decision to make. So I often just kind of, like, give space for folks that are asking me this, and, you know, talk about, like, options and talk about, like, resources that are in one state versus another. But I personally feel like I can't answer it, but I acknowledge the reality and the hurt that people are experiencing.
And yeah, I think that especially because every individual and family story and space and locality is going to be different. Unfortunately, I don't think there is like a kind of clear answer that would apply to every situation. I'd echo what Jay's saying, and also say, especially because, as we showed on those maps, things are constantly shifting so frequently, to really get connected with your local organizations. You know, whether I can see in the chat, you know, reference PFLAG. So whatever those local organizations are, because those local orgs that are, and whether they're local chapters of national orgs like PFLAG, or you know, I can name all the ones in Virginia, but that only works if you're in Virginia. But you know, they're staying very attuned to the landscape in your area, and also having that community and having those organizations, like, knowing who they are, and providing that support is going to be really helpful if there is any fallback. What's also important to keep in context too is that while all these legislative moves have happened, the legislative makeup could be shifting very soon. It is October, and keeping that in mind, that we don't know which one of these are going to possibly get potentially worse or better, and that we haven't really seen how these laws being enacted on an individual level really have played out. So in terms of what does if the law does say, like, that you could be reported for misconduct or abuse or whatever it may be, or be arrested, you know, we don't really know how that's going to play out when it actually gets to, like, a criminal charge or legal charge. And so we're not sure, you know, how I guess the teeth that's involved in some of these. And that in itself, the unknown can be scary. Also, in states where access may be restricted, but you don't have those policies that are potentially implicating you as the parent or caregiver, keeping in mind that those community and those mutual aid and that network space of access, because if the laws aren't really targeted towards you as the caregiver, but more so the providers, and there is a way to get care in another area, that's also something to explore. Speaking as my own lived experience and many others that I've worked with, for many times in my life and others, we've lived in areas that there wasn't anywhere to access care, but through that mutual aid, we're able to find creative ways to get care. For example, when I lived in West Virginia, I had no place to go to for access to trans healthcare, but through mutual aid and support and friends and community, I found ways to get to DC as needed for that. And so thinking about those pieces too, of like really leaning in, the community leaders in your area are the experts and they're paying attention. And so I would say focusing there, and when you can, join in if it's related to schools. I'm sure as many of you might have saw, because it made national attention, students and parents, like students walked out in Virginia trying to challenge these policies. And the more that we can show up and fight these, it's possible that we might see the tides turn as these policies are being argued in the next few months.
Those are fantastic answers. And I was also looking up in the chat and people were saying like vote. Well, yeah, that's another one of those places where, all of our votes matter, all of our voices matter. And as you were talking, I was thinking too about, mutual aid is great. And where does harm reduction play a role? And, I know that a lot of us would rather have our kids stay alive or our other humans, adults stay alive. And if that means sharing hormones with each other or doing what we can, not the ideal situation, but it's kind of like, would you rather have somebody be alive or reasonably okay, or go through official routes? And again, I'm not advocating for either, but yeah.
Yeah, and I also like to highlight too, and this isn't necessarily a tactic that I use regarding legislation, but I use actively when talking to people that are pursuing either medical transition or not sure if medical transition is right. There are also lots of other steps that can be done to help affirm ourselves and bodies. And people often think of like their appearance and clothes and things like that, but there's also a lot of holistic ways that we can change our bodies and change the way our bodies feel and kind of utilize hormones organically, and the way that our body shapes and sizes can change through things like related to like nutrition and physical activity and targeting different things. So there's a lot of ways that we can use just our natural resources and our bodies to help provide some of that affirmation in absence of access to like a physical prescription and things like that. And there's lots of good resources out there for that, but I'm happy to share some of those if folks are interested.
Thanks. So, Jane, after I want to give you a minute or two, or however much you'd like to share any magical last words for tonight before we close.
I think I just want to echo something I said earlier, that just something practical that you guys can leave with tonight. If like I said, if anyone is, so one of the things I'm like very nerdy about is like community defense and things like that. So like something that I'm putting together specifically for like a lot of friends and folks that I work with is just like resources and things that you can do to it sounds like that is going to be covered later on as well, but if folks are interested in like resource sharing and seeing that list of just specifically that was made from the framework of abortion providers on how to protect yourself, like we talked about, I would love to share that with folks if folks are interested. So just let Michael know, I guess, by the email, and then I can make sure it gets sent out if folks are interested in learning from folks that have been doing this for a while in the movement of abortion rights and protecting folks. So yeah, that's all I wanted to say.
Yeah, and the only thing that I wanted to end on is that definitely tonight we wanted to kind of lay that framework and foundation. The next time we come back, we did want to move into, I think, some of where these questions were geared in terms of some of those strategies and what the work in care can look like. So stay tuned for that. But wanting to just really uplift that many of us have found ways to teach and train each other, kind of getting to that harm reductive approach, and that there are many free, accessible for most who can find access to internet. And if you can't, we can definitely help try to manage that gap. Things to learn about care and these different services and healthcare and ways to support our bodies and our loved ones' bodies and autonomy. And so really leaning on our own experiences and our own shared wealth and knowledge, because we have a lot of it, and we can find creative ways to share that information to make sure that when people don't have ways to get to a official medical institution or mental health provider, they can still access and utilize some of these shared tools to be able to listen and learn from their body when not able to access those kind of traditional methods of medicine.
Thank you both so much. This was a great part one, and I'm really, really excited for part two, both of which are just like going to be fantastic. And I want to definitely thank all of the folks that are here listening tonight and that are going to be listening when we move forward and share this with other folks. So I hope everybody has a great evening, and we will see you back maybe next week, maybe later this week, and in 2 weeks again to see Jay and Afton share more good stuff. So thank you, everybody, and have a great rest of your night.